Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shaver. Welcome to Monday Health Minutes with Valley Health. We had a conversation last week with Dr. Scott Murphy about dementia, what it is, how it's described. Well, today we're going to continue that conversation and talk about what we can do to prevent this diagnosis for ourselves. So thanks for staying with us and giving us more explanation. What can you do lifestyle-wise? What changes can you make to avoid this diagnosis?
I will say that it's worth saying first, there are some causes of dementia that there's very little we can do about, such as our genetics. And so if there's a family history of certain types of dementia, then we may or may not receive the genetics of that type of dementia. And even if we did, it is still up in the air and not very predictable as to whether we'll develop it ultimately. But there are a few things that are well within our control.
That's the part we want to talk about.
That's the part we want to talk about.
Yeah, that's encouraging.
So one of the biggest factors is overall health status, and this includes lifestyle factors such as good nutrition. Certain types of diet have been very strongly associated with reduced risk of dementia, such as the Mediterranean diet. You may have heard of that. Increased exercise. Taking daily walks, getting in those 10,000 steps, those can reduce the likelihood of developing dementia by as much as 50%. And that's a substantial decrease in the outcome. And particularly for those who have struggled with cardiovascular health, who have a family background of dementia, it's incredibly important to take those preventative measures and make sure we're getting the right nutrition and maintaining control over our general health and getting that exercise in there.
Yeah, 50% is motivation to at least do your best. Let's talk a little bit about the dietary changes too, because you mentioned Mediterranean diet, a lot of vegetables, a lot of lean meats, but there's also been some studies about dairy and whether that's good or bad for dementia.
Sure. So dairy is sometimes associated with increased incidence of adverse cardiovascular outcomes, right? Just as with meats, any source of fat or any sort of high-calorie sources in the diet can be associated with that. So there have been good associations with more of a vegan-type diet, although even there, too, you have to be careful and watch for any sort of nutritional deficiencies. So.
Moderation the key?
Moderation is the key.
Well, all right, so just be healthy and move. That's really always encouraging.
You know,
that's parts in control.
I would like to add a third to that, which is to avoid smoking, because again, it is one of the biggest risk factors for overall cardiovascular health. And it's a preventable cause too. So
it is.
Making an attempt to move more, eat right, and not smoke. Those are kind of our big three.
Yeah, to keep yourself from going down the dementia path. At least do what you can. Well, let's talk about effective treatments. There's all kinds of different medications out there that can help manage.
Sure. So in the early course of dementia, and what we would think of as sort of the first stages, the first few years, and in dementia, we think of a timeline of about 10 years to work with the different staging. And the first 2 to 3 years, we would say, is the early part of dementia. There are medications called cholinesterase inhibitors. An example of this would be Aricept or donepezil. What it does is to increase the available choline in the brain. Choline is important for memory formation and for cognitive processing. And so this medication, there's no evidence of this medication affecting the long-term course of the disease, but it can provide some short-term benefits in terms of improving day-to-day life. It may increase cognitive scores by a few points, and it works until it doesn't. Okay, so it's not a disease, it's not a prognosis-altering medication. It is more of a symptomatic treatment that can work in the short term. Later in the course of dementia, medicine like memantine can help, and that one targets a different receptor in the brain. It's an NMDA antagonist. And to some extent, well, there's no evidence of it helping much in the early stages of dementia, but for more advanced cases, the last few years of a dementia, it can provide some modest benefit. And all of these medicines, they provide some modest benefit overall. And little things matter. So even if it's just having a few more focused conversations and having a little less forgetfulness day to day, those kinds of things are a good outcome.
All right, Dr. Murphy, thank you so much. We could talk about this for weeks on end, I think, as it affects so many families, but we appreciate you sharing your insight with us today.
You're welcome.
Thanks for checking in for Monday Health Minutes.